Inside the human body exists a highly sophisticated transportation system. Fat does not travel alone. It relies on specialized transport vessels, known as lipoproteins. Among them, LDL has long been labeled the villain. In reality, however, LDL is part of a natural biological mechanism that, when thrown out of balance, can contribute to cardiovascular and cerebrovascular disease. There has been ongoing debate over whether large LDL particles, pattern A, are safer than small dense LDL particles, pattern B. However, the latest scientific evidence confirms that the most critical factor is the particle number. The greater the number of particles circulating in the bloodstream, the higher the probability that they will collide with and become trapped within arterial walls, regardless of whether the particles are large or small. Statins act as regulators of this system by inhibiting the enzyme HMG-CoA reductase in the liver, a key driver of cholesterol production. When the liver reduces cholesterol synthesis, it compensates by pulling more LDL particles out of the bloodstream for reuse, effectively lowering blood lipid levels. Beyond simply reducing cholesterol numbers, one of the most important benefits of statins is plaque stabilization. Statins help promote calcium deposition within arterial plaque in a way that makes the plaque more stable and less likely to rupture. This significantly reduces the risk of sudden blood clot formation that can trigger heart attacks. Older medical references often listed extensive side effects, sometimes as many as 66 different adverse reactions. However, large-scale meta-analyses involving more than 120,000 participants have shown that many of these concerns originated from preliminary observational reports. When compared with control groups, most side effects demonstrated little to no statistically significant difference. Muscle pain or myopathy, one of the most commonly feared complications, occurs in only about 1 in 10,000 patients per year. Severe muscle breakdown or rhabdomyolysis is even rarer, affecting only 2 to 3 individuals per 100,000. These findings help place the actual risks into perspective and reduce unnecessary fear surrounding statin therapy. Statins may slightly elevate blood sugar levels in individuals who are already at risk for diabetes. Nevertheless, their cardiovascular protective effects overwhelmingly outweigh this concern, especially in diabetic patients, for whom maintaining LDL levels below 70 mg per deciliter is considered a crucial strategy for long-term survival and vascular protection. Although statins may theoretically reduce the body's production of CoQ10, clinical studies have not shown meaningful improvement in muscle symptoms from CoQ10 supplementation. Therefore, clinical attention should focus more on monitoring real muscle symptoms rather than worrying about CoQ10 blood levels alone. If side effects do occur, physicians have multiple adjustment strategies available. These include switching between different statins, such as from lipophilic to hydrophilic agents, lowering the dosage while combining therapy with other medications, or utilizing newer lipid-lowering agents to achieve LDL targets while preserving the patient's quality of life. Ultimately, the use of statins should be based on individualized cardiovascular risk assessment. Statins are powerful tools for reducing the incidence of stroke and heart attack, and when combined with lifestyle modification, they offer a sustainable path toward long-term health and protection against serious vascular disease.